Morning, everyone. Welcome to another edition of the Gamma Pi chapter of Omega Psi-Phi Fraternity Incorporated, our ongoing webinar series for our health initiatives program. Today, we have a special treat for you. Today, we're going to be talking about stroke, risk factors, symptoms, and what to do. Today, we have our Dr. Nicole Mahdi, medical doctor. She is a vascular neurologist and director of the stroke program at Sinai Hospital of Baltimore. She did her training, her undergraduate training at Howard University, HBC grad, medical school at the University of Maryland School of Medicine in Baltimore, and her neurology residency at the Thomas Jefferson University in Philadelphia. Not only that, but she completed a vascular neurology fellowship at Emory University, Grady Hospital in Atlanta. So with that, welcome, Dr. Mahdi.
Myself. Good morning, everybody. Glad to be here. Thank you so much, Quentin, for having me. It's a pleasure to be here this morning to tell everybody about what I love to do.
No problem. So I guess first things first, just to start off for those who may not be aware or may not know exactly what's going on, what exactly is stroke and what is it doing to the brain?
So is it okay, Quentin, if I share my screen?
Yeah, absolutely.
I think that I oftentimes in my line of work, especially with the patient population I take care of, visuals are often very useful in sort of really understanding what's going on. Because I think that stroke and heart attack are on a very similar wavelength. And sometimes sort of explaining it in that way, I think sometimes makes it a little bit easier to understand. So I'm going to share my screen very briefly, give you a little bit of statistics. I think this usually shocks most people. And then give you some visuals so I can answer that question, I think, in an even easier way for folks to understand. So I'm going to share my screen. All right. Can you see that well?
Yep.
Okay. So, you know, the crazy thing about stroke is that people don't really realize how much this of a, I would consider almost a health crisis that this is, not just in the United States, but in the world. And as crazy as it sounds, someone's having a stroke every 40 seconds just in this country alone. Over 130,000 Americans die of a stroke each year. 1 in 19 deaths in the US are from a stroke. And actually, the statistic of the 5th leading cause of death is an improvement. It used to be the 4th leading cause of death, but actually got stepped down given the miraculous advances in stroke care that we've been able to do to not only save lives, but change the long-term outcome of those that suffer a stroke in the past 10, 20, 30 years. It is, unfortunately, though, the 2nd leading cause of death worldwide. And close to 800,000 people in this country are having a stroke every year. So as a result, when you talk about diseases that cause long-term disability, stroke is the #1 leading cause of such. And so to answer your question about what a stroke is, strokes are actually come in two flavors, which a lot of people don't actually know, where most strokes are what we use the term called ischemic, and the other smaller section are what we call hemorrhagic. And this next slide will help me sort of explain exactly what a stroke is and how it involves in the brain. So this visual gives you an idea of the difference between the two. So by definition, a stroke is basically, you've got this beautiful network of blood vessels that's over in your far right that constructs your brain, okay? These are basically the tree trunks and the major tubes that break up into even smaller tubes that supply all the blood flow to all several sections of your brain. And the brain's a remarkable organ. It's broken up into distinct sections and parts that do particular things. And so it isn't sort of a mishmash of tissue. It really does have a map that lines out one particular part does 1, 2, 3 particular things, and so on and so on. So these arteries directly go to particular parts of the brain and feed it with the oxygen and blood that it needs to survive and live. Unfortunately, what happens during what we call an ischemic stroke, which is most of the cases that you see, is if you look in that pictorial that blew up a little artery, basically an artery feeding a part of the brain gets blocked, whether it's due to clot, blood clot, cholesterol plaque. And as a result, by blocking that artery, as a result, you no longer get blood flow to a particular part of the brain, and that brain essentially dies, that tissue dies. As a result, whatever part of the brain that area was responsible, maybe it was responsible for your ability to talk, or your responsibility to use your right side, or your ability to smile. You will lose the ability to do so, given that part of the brain was starved of oxygen too long, and as a result, that area basically died. And this is exactly similar to what happens in a heart attack. You've got blood vessels that feed different sections of your heart, and during a heart attack, one of those arteries is getting blocked, and as a result, that heart tissue can't survive without getting enough oxygen and blood flow. Now, the other part is this smaller incidence of stroke, but we see it quite a bit. It's called a hemorrhagic stroke, or a bleeding type of stroke. So those same blood vessels we talk about instead can rupture, okay, and explode. And as a result, those blood vessels will leak blood. And as a result, you will get bleeding in the brain that will cause pressure on those same parts of the brain that an ischemic stroke may affect. And as a result, will not allow your brain to function in that particular area. And I'm going to stop sharing.
Go
ahead, Quentin.
So seeing that description, how does that differ from, let's say, like a brain aneurysm that I know some people are worried about could randomly happen to you?
Yeah, so a brain aneurysm also results in a hemorrhagic type of stroke. So basically, all those arteries that I showed you on the picture, some of them are more susceptible to basically the lining being weaker than other parts. As a result, it creates kind of this little mushroom or bubble that pops out on the artery, and that's an aneurysm. A lot of us may have one, and you don't know, and they can be very, very, very small. And as long as you don't do things like smoke, have uncontrolled high blood pressure, throw salt all over your food, those little aneurysms can be in your brain for your whole life and never cause a problem at all. Some people have them genetically, meaning if you have a family history of aneurysms, you definitely should get screened for them. But many people, even people I take care of for stroke, I find they have aneurysm. We just watch them every year. And for most people, they don't cause a problem. What happens with aneurysms, though, is unfortunately, that little pouch that gets formed, the lining is way weaker than a normal blood vessel. So it has a higher risk of bursting. If it does, it causes bleeding, but not in the brain, actually in the spaces that are in between the brain tissue where the blood vessels sit, which actually is a lot more irritable and angry to the brain. And that's why aneurysms rupturing can result in severe stroke and even death. And that's the main difference between an aneurysm causing a stroke and sort of your typical stroke that you see on your everyday basis.
Okay, thank you for that. So recently in the news, like speculation has been running rampant about a certain celebrity possibly having had a stroke. And I guess it probably catches people by surprise because they might have it in their mind that a certain demographic gets it, like maybe just overweight people or people who smoke or older people. And certainly there might be risk factors, but can you touch on like who is susceptible to strokes?
So the answer to that is everybody. I take care, probably my youngest patients are in their 30s. And then I have patients that are in their 90s. I think people assume stroke is a disease of old people, and unfortunately it's not true. The problem is that the risk factors for stroke are not diseases of old people anymore, because most of them are what we call modifiable, which means you can control it by taking care of yourself, meaning exercising, putting good food in your stomach, eating healthy, not smoking, not using illicit drugs, for example. And so those common things, the most common causes for stroke are hypertension, high blood pressure, high cholesterol, diabetes, smoking, obesity, also drugs, certain drugs, specifically cocaine, can increase your risk of stroke. Sleep apnea, which I know a lot of people have and don't go get tested, because it's so easily treated, since that condition in itself can result in high blood pressure, especially at night. And a lot of people have strokes in their sleep. And so those are things that you can do personally to take care of yourself. There's things that you can't control, like being older, which is an increased risk of stroke. Unfortunately, being African American and being a woman. But those things you can't change, but you can change how you take care of yourself. And the problem is that people ask, how do you have a 30-year-old in your clinic that's had a stroke? Well, some of them are things that they can't control. There are genetic factors, genetic conditions that increase your risk of clotting that can cause stroke. That's something you can't control. Sometimes there's structural problems in the heart that can cause stroke. But I guess what? I have 30-year-olds who have high blood pressure, high cholesterol, diabetes, who are smokers, who are obese. And as a result, just because you're young doesn't mean that if you have conditions of older people that you can't also have a stroke. And so I always say that everybody is at risk of having a stroke if you don't do the things to take care of yourself now, even though more commonly you see older people with it. So I think it's not to scare everyone, but it's a reality check to say that, hey, if you take care of yourself now and keep it going, you won't develop those risk factors that will increase your risk of having a stroke moving forward. And also I want to say, it doesn't mean that, let's say you are a diabetic or you have high blood pressure, or you have high cholesterol, that it's inevitable that you're going to have a stroke. That's just not true. Your risk is higher, but if you find out you have those conditions, which means seeing your doctor regularly every year, getting a diagnosis, getting on medications if you need to, changing your lifestyle, you can control those risk factors so that they never end up giving you a stroke.
And you touched on some before about, I guess it used to be the fourth leading cause. So in some ways we're doing better, but I guess in other ways, Americans' health seems to be almost getting worse. Like you have more obesity, more other health issues, especially in younger folks. I mean, you're seeing colon cancer in younger people. Mm-hmm. So in some ways, are we seeing are you getting more and more younger patients at all? Or?
I wouldn't necessarily say that yet per se. I think that young people have probably been having this issue for decades and decades and decades. I think that it going from 4 to 5 is really a means of just attesting to the technology that we've developed to save people's brains in the moment. And I'm sure we'll talk about that soon, about what those things that we're able to do. As to why it has dropped down, we've been able to save more lives just because of what we're able to do, despite the fact that it does seem like our population is getting more and more less healthy.
And you touched on being able to, save the brain in the moment. So in the moment, what are some signs of having a stroke? It's kind of a scary thought. You mentioned most people have it in their sleep, but if I'm alone, mm-hmm. or whether I'm with somebody else, what can I see either in myself or in the person I'm next to that would tip me off that hey, something's going on?
So I'm going to share my screen one more time, because I think this is the mnemonic that maybe you may have heard on TV or around, that we use as a reminder for everyone to recognize the signs of a stroke. So you see this little fancy picture here. This mnemonic is called Be Fast. This is sort of what we drain into the community and to our patients, to how you spot stroke symptoms. And it's great because I think it gives you sort of the major things to look out for. There are a lot of different symptoms you can have, but I think this sort of gets the most common ones together. It used to be just the FAST, which maybe most people are familiar with, but the BE got added in recent years, given the fact that these are symptoms that may not be as apparent, but are symptoms of a stroke. So I'm going to start with the FAST part, because that's the part most people are aware of. So F stands for face, which basically means that, is there something wrong with the symmetry of your face? Is your face droopy? When someone tries to smile, does one part of their face not move? So I tell people, hey, if you think something's wrong, run to your mirror and look at your face and see, or take your family member and take them to a mirror and look in their face. A is arm, which also is analogous to your leg, because often when the arm gets weak, also the leg does. Is that, does the arm not, can you, if someone, you try to hold your arm up, or your family member's arm up, does it drift down? Can they even lift it up? Does it drop immediately to the bed? When they try to squeeze your hand or push you away, is it weaker? And you can allow, that also goes to the leg as well, the same thing. So weakness of one side of your body, of your arm and or your leg, is a sign of a stroke. S is for speech, is when people aren't talking right. So speech can come in a variety of buckets. It can be your speech is slurred, meaning the words they're saying may be correct words, but they're very slurred. It's hard to understand. It could be people have trouble communicating. They either don't understand what's being told to them, meaning they're confused or having trouble following directions or answering questions, or they may even be able to know what's going on, but they can't express themselves. They're having a real trouble getting their words out correctly, completing a sentence, or answering questions. So sometimes I say, tell them to say a simple phrase and see if they can complete it. And then T is for time, meaning don't wait. I always joke and tell my patients, don't pass go, don't collect $200, don't even call me. You need to call 911 immediately, because everything about stroke is time. We have things that we can do to save the brain, but we have a very small window of doing such, and you have to get to the hospital immediately. Even if you wake up at night, you wake up in the morning with a symptom, meaning you went to bed fine, you wake up and all of a sudden something's wrong, it's not too late, go to the hospital. Now the B and the E got added lately, given the fact that these symptoms aren't as commonly seen and frequently missed, because people don't assume that they're stroke symptoms. And so B is for balance, which means that people are either extremely clumsy and coordinated, they're falling over, they're leaning on one side or the other. And E is for eyes, something wrong with your vision. Most commonly, it's loss of vision, whether it's in one eye or both eyes, and double vision. And so when it comes to stroke is something that hits you like a ton of bricks. So it isn't sort of a gradual thing. It's you're fine 1 second, and then you're not the next second. So it's very, very, very immediate, or what we call acute, out of the blue.
And then with that time, do you recommend people do 911 first? Like, in the panic, like, is it okay for somebody to, drive somebody to the hospital because they feel like that'd be faster, or just always stick with 911? I saw you mention a certified stroke center. So, that, I guess that also means you can't just go anywhere too, right?
Absolutely. And most people don't actually know their neighborhood hospitals and what certification they have. Most emergency rooms are called primary stroke centers, so they can take care of the basics of stroke care. And then there are other ones called comprehensive or thrombectomy capable centers where I work, where we do even more advanced stroke procedures. And you can get transferred to those places when you start at a small hospital. But to that question, I always tell people, first of all, if you think you're having a stroke, do not get in your car and drive to the hospital. You are at risk of hurting yourself and others because your brain's not functioning. So something's not going to work right. And as a result, you can harm yourself or others getting in an accident or whatever. If you have a family member, I know everyone's assumed, well, I can get there faster. Call 911. And the reason is, what if you never know within the matter of 10 minutes you think it takes to get to the hospital? You're not including the time to get your family member who can't walk and carry them in the car, get them out. And also, as a result, you don't have the pre-hospital warning. So EMS is very good at, if they respond to a 911 call and go to your house, they can notify the emergency room that they're going to drive you to, and they will take you. They have certain score symptoms, especially in the state of Maryland, where they sort of bypass some centers that they think that may not be capable of caring for you, depending on how severe your stroke symptoms are, where they notify the ERs, hey, I got a stroke coming. And as a result, it gets everybody ready. It gets the team ready, gets the ER ready, get the pharmacist ready, get the lab techs ready, gets the doctors ready, gets everybody ready for you to show up. Because like I said, time is everything. Every second counts. Every second you waste, those are millions of brain cells you're losing. And so you don't want to waste a second. So I always tell people, call 911, do not try to do it yourself, and definitely don't take yourself to the hospital.
And we have a question from the audience kind of related to this as well. They asked, with speech, some people say if the person can't spell stroke, it might mean that they have the signs leading to it. I guess, do you agree with that statement? Or
I mean, I think it doesn't. I mean, if they can't spell, period, something's wrong, right? If stroke is a simple word that everybody should be able to spell and they can't spell the word, then maybe they're having trouble speaking. And you can use any base. I want you to understand this is people assume that when people are having a stroke, it doesn't matter. You could have 80,000 degrees. You could be the smartest person that you know. When that part of your brain's not working, you can't do the simplest thing. You can't spell the word cat. You can't say the word hello. You can't say your name. Okay, so the basics go away because it doesn't matter how smart you are. Doesn't matter how highly intelligent you are. When a part of your brain is not functioning, you can't do anything. So the simplest activities are impacted from it. So whether you want to use the word stroke or you want to use the word hello, if you're having a stroke and you can't spell, you won't be able to spell either.
then on that same note, in the essence of time, let's say you're waiting for 911 to get there. Like once you've identified it, is there anything that you can do in the meantime, or is it just waiting for the services to arrive?
Unfortunately, no. And I think that this is one of the things I commonly get where they say, Doc, I knew he was having a stroke, so I stuffed 5 aspirins down his throat. And I'm like, no. And the reasoning is this: it's different for heart attack treatment. So if you think you're having a heart attack, you take an aspirin. That's a known thing. Okay. While you're waiting on EMS, take an aspirin. For stroke, you do not. And the reason is what I mentioned before. Stroke comes in 2 flavors. So if you're having a bleeding stroke, you are feeding your brain more blood thinning, which could worsen the bleeding that's already happening. And you can't tell the difference. So the same symptoms from a ischemic stroke are the symptoms of a hemorrhagic stroke. And you will not know the difference until you get to the hospital and we scan your head to check for which one is going on. So what I always say, do not give your family member or yourself anything. Don't give them medicine. Don't give them aspirin. Don't give them food. Don't give them water. Don't give them anything. Because also strokes can affect your swallowing function. And if you give someone that's having a stroke something to eat or drink, and they actually have trouble swallowing that you or they don't know yet, you can actually cause them to have that food or water go down into their lungs and increase the risk of having an infection or pneumonia. So unfortunately, it is terrifying, but there's nothing that you can do or give that's going to speed up, slow down, or stop what's going on. You need to wait for EMS to come. They'll come and check vital signs. They'll make sure that you're stable. They'll get you in that ambulance as soon as physically possible and get you to the hospital.
Gotcha. So that being said, once you get to the hospital, they start triaging you. Is there some type of scoring system or some other way of classifying how bad it is? And how do they even go about determining that?
So it is one of the most rapid and fastest processes that people can ever experience. It's a madhouse when people come in. You basically get jumped by a whole lot of people. You get jumped by us as the doctors, where we're doing a neurological assessment. It's called an NIH stroke scale. So the National Institutes of Health has a stroke scale that's been out for, my goodness, probably 100 years, that we use to assess certain parts of the brain. And that numerical scale, we add up, and usually the higher the number usually means the more severe the stroke, even though That's not necessarily true. And it's for a variety of reasons. Like I mentioned, that B and that E and that B fast aren't necessarily scored very effectively on this scale. And so you can have a low number, but you can have quite disabling symptoms. And we, as a neurologist, our job is to determine, we do that stroke scale, we determine the disability that this is going to impact you. And that determines for us whether or not we think that you're eligible. It's also time. So there is a medication called Alteplase, or in some institutions, you may see something called tenecteplase. It's a newer medicine that most of us are transitioning over based on new data, that it's a lot more effective and efficient than the old medicine we used to use. We still use it now, but we're transitioning it over because it allows us to do our job a bit quicker with the same efficacy. And we only have 3 hours for everybody, 4.5 for most people to give you that medication. Anytime outside of that window, you're not eligible, because the concern is that the stroke has been going on too long. And by giving you the medicine, we actually can cause you to have bleeding in the brain from the medicine, because it is a very strong blood thinner. That is, the goal is to basically take that clot, bust the clot up, so that you can restore blood flow back to the area of the brain that's suffering. Now, when people come in, the biggest question people say, well, I woke up, meaning I went to bed 8 hours ago, right? Am I eligible? Unfortunately, you're not. Even though we are doing a lot more studies where we're trying to use special images to decide that even if you wake up with a stroke, we can determine whether or not maybe that medicine may be safe for you, even though we don't have an exact timeline. And some strokes, only the medicine we give you can help fix it, meaning it busts the clot up. And unlike the movies or the medical shows, you don't get better in 5 seconds. It takes a while for the medicine to go through your body into your brain. But the data says that if you're able to get this medicine in 3 months, you're going to be way better off than you were if you did not. And so that's why we use it. And it sort of reduces the burden of stroke that impacts your brain, because we're able to restore some blood flow to those areas of the brain that are otherwise wouldn't. Now, there are some strokes that are a lot more severe, and that scale helps us determine that, where a very major blood vessel is being blocked, meaning that blood thinner may work, may not, and oftentimes it does not enough. And we have a particular procedure similar to what they do for heart attack people, is where we can actually take a catheter and string it up into your brain and use a fancy device, physically take the clot out of the blood vessel that is blocking it, to restore blood flow, to save your brain from dying. And we have special pictures that we determine that we take when we get there that tell us whether or not you're eligible for that particular procedure. But it is all about time. So, for example, if you say, yeah, I've noticed my right side's been weaker for the last couple of days, but I didn't want to go to the hospital and now I'm coming. It's too late. Can't help you. You don't qualify for any of the medicines, no surgeries. And at that point, it's all about, my job is, why did you have the stroke? Getting you on the right medicines and prevention mechanisms and rehab. But we don't have any emergency treatments because it's already been too late. So I always say that if you are within 24 hours, when you are a normal human being, you may be eligible for treatment. So you have to get to the hospital immediately, because it's all about time. All about time. Don't brush it off. Don't say, I'll do it later. I got something to do. I don't want to deal with it. I hate the hospital. Every second you waste is a second that may prevent you from being able to get treated.
And that's crazy to think. And I guess something that maybe people don't realize, a stroke isn't necessarily something that just hits you and is very dramatic. Like, you can just feel like a little weakness, and like you might be having a stroke, and it could be like, I guess, not bad enough that you even consider putting it off.
Yep. And I think that's what happens, is that it may not be that bad and you're able to function. And people say, it'll go away. I get that a lot. I thought it would go away. And it didn't. And so you've got to call immediately. Every second counts. And something that may start out not so bad can evolve to be bad over time, because the brain does have a way of trying to compensate for itself. And so you may start with a little bit of weakness. I don't know, I feel a little weird. I can't write right. My hand's a little weak, but it'll get better. And then in 6 hours, all of a sudden, your hand's not moving. So you really do have to be on it. And just even if you're like, I don't know if this is a stroke or not, it is not something to play with. It's better safe than sorry. Call 911 and have someone check you out.
Yeah, it's good to hear, because I think when you watch a movie, like you picture like them having seizures and it's this huge event, and it could really just be something that's subtle as that.
Yep.
So after getting checked out, they've determined you had a stroke, been giving you some medication, and maybe you're on the road to recovery. What forms of therapy are there out there to treat post-stroke? Can you go back to living a completely normal life?
You absolutely can. So the brain's a phenomenal organ. That's probably why I chose to study it. It has a really remarkable way of trying to restore itself even after it's been injured. I always tell folks, I can't give you your brain tissue back, but the rest of your brain does so much. It really tries to repair itself in a way where it utilizes all these other areas of your brain to sort of help that part of the brain that's not working so good. And so stroke recovery is possible. I have people that go back to complete normalcy. I have people that come close to it. They have a little bit of symptoms left, but it doesn't impact their regular lives. They go back to driving. They go back to working. They go back to enjoying their lives. Unfortunately, some people with very severe strokes don't make a recovery enough to be independent, but maybe they gain the ability to speak again or eat on their own, or even the basic of saying, I can walk, even if it's with a walker. And so stroke recovery has a big wide net. Unfortunately, we do not have a magic pill or a magic predictor that tells us whether or not you are going to go back to 20% of yourself, 40%, 97%. The only treatment we know that expedites that process or gives you the best shot is therapy. And so we try our best to get folks in physical, occupational, and speech rehabilitation as soon as possible after a stroke to give you the best chance of getting better. Unfortunately, there are some things after a stroke that can be separate from your original problems that can cause issues. Some people have headaches, pain, tightness in their limbs, sleep problems, mood issues. People can get very depressed and anxious after a stroke. And we have treatments. We have therapy for it. We have medications. We even use Botox to help with people that unfortunately from part of their body that doesn't move so well anymore. It can get very stiff and tight, and people can have spasms, and there's injections, Botox injections we can to help with that. So we have a lot of strategies of post-stroke care to help people get through that process as painless and I also emotionally challenging to sort of ease that emotional challenge. Most people that have a stroke came from complete, utter independence, and they went from that one day to 1 second not being independent anymore. And that can be very mentally tasking, not just on those affected, but caregivers. And so we provide support not only to those who suffer a stroke, but caregivers. There's stroke support groups. We do have one at our institution at LifeBridge to try to encourage folks to sit around and talk about their experience with other people that have also had a stroke. So you feel like you're in a community of understanding. But stroke recovery is absolutely possible. And I have loads and loads and lists of people that are going back to their regular lives.
And that's good to know that, it's not all is not lost. That being said, especially with disparities of health insurance, like is all of this covered, or do I have to worry that, this might happen to me and, I can't afford the therapy or things like that?
So that is definitely something that I think, particularly in our community, makes us a bit fearful about seeking medical attention, because the fact that it is true of the healthcare system in this country is expensive. But you could be a homeless person on the street. If you get brought to the ER having a stroke, we're going to take care of you. As a doctor, I don't look up your insurance plan or your policy or how much you're going to cover. My job is to save your life. So no one blocks you at the door and tells you, sorry, we don't take Cigna. I can't help you. You got to go somewhere else. That becomes more of an issue after you're being taken care of in the hospital, where you're dealing with outpatient follow-up with your doctors, getting outpatient therapies. Yes, there are issues where, depending on insurance coverage, things may not be covered completely, or you have to do a little bit of out of pocket. And that's all variable. In my experience, most of my patients, particularly if they really are trying to get better, they find a way through family support. to do what they need to do to get better. But I mean, it's a huge financial burden, not only is to the healthcare system. Of course, you know, if someone comes in who's homeless and having a stroke, I'm caring for them for, doesn't matter how many days. And guess what? The bill's going to be swallowed by the hospital, by our taxpayer dollars. It is what it is. But the last thing you should ever do is try to use money or insurance restrictions to not seek medical attention when you are having something as serious as a stroke. You know, it's one thing if you're thinking of something elective, cosmetic, but we're talking about your life. A stroke can kill you. And so you really do have to knock all that out. The doctors have no salt in the game. We just show up, we go to work, we help people. I'm not even thinking about how much money you make or what's being covered and not being covered. I'm going to do what I need to do to make sure that I get you well. And the good news is hospitals are full of case managers and social workers, and they work through whatever you're dealing with. They know what your insurance you have. They go through what's covered and what's not covered. You can always have communication with the hospital to talk about how much am I going to have to pay for this? How much am I not going to have to pay for this? So you have an idea. And so things can be expensive, you know, but I think that when we're talking about your life, I think you think about that stuff later. And I do have a lot of folks that sit in hospital beds and they're already asking me, well, what about this and work and driving and paying this bill? And I always say, last thing we should be worried about right now. Let's get you better. All that other stuff will fall in line. There are services that the hospital provides to try to help people out financially. Even we have folks who come in uninsured. And in order to get them to rehab, they need insurance, right? Insurances don't just take people with, if you don't have any coverage, someone's going to pay them, right? Whether it's you or an insurance company. And before you leave, we actually will work with you, case managers and social workers, to get you insurance before you leave.
So let's say, you know, you go through the physical therapy, you're finally to the point where, hey, you're feeling a little bit normal. Having said that, if you had one stroke, even if it's a mild one, are you more susceptible to having a second?
By definition, yes. Your risk is higher since you've had one to have another. That risk is usually the highest within the first year. So I always tell people to really utilize that first year after a stroke as a means to really get all your ducks in line, meaning make that lifestyle change, eat better, exercise, quit those cigarettes, right? Lose that weight. Make sure you're taking your medications, right? So yes, you do have a higher risk of having another stroke, but I always tell people, doesn't mean you will. I always tell people it can be one and done. And because most stroke is completely preventable, changing your life can reduce your risk of having another one.
And along those same lines, just having a stroke in general, does that increase your chances of having other health issues like a heart attack or anything else? Or
I would say in a way, yes. And the reason is this, is that, you know, if you're having a stroke due to things that you can modify, right? Pressure, cholesterol, diabetes, smoking. You got to keep in mind those same arteries in the brain that were not happy about how you were taking care of yourself. The arteries in your brain are no different than the arteries that go to your heart, right? No different than the arteries that go to your legs, right? You hear about diabetics losing legs and losing feet and losing toes, all that circulation. And so if you don't control the things that gave you the stroke, you can develop and have heart disease. You can have, circulation problems in your legs. And so, you know, your body's a whole well-oiled machine. I used to tell people, if your arteries in your brain aren't healthy, the ones in your heart probably aren't either. The ones in your legs probably aren't either. And so you definitely are susceptible to having other organ issues. And it's not uncommon that I see people who have a stroke and they haven't seen a doctor in a decade. I have diabetes. When's the last time I saw a doctor? Oh, I have high blood pressure. Shouldn't I feel it? They call high blood pressure the silent killer for a reason. A lot of people don't feel it simply because your body compensates, and some people compensate better than other people. So, you know, the way to, you know, what I say, the best way to prevent this to ever being on your problem list when you go see your doctor is go see your doctor. And do it now. Do it young, you know. Because the reason why I have patients in my 30s is that people in their 30s can develop diabetes. And the problem is that, a lot of times we've got a little genetics fighting against us and you may not even know. Knowing your family history is very important. Knowing if your parents have high blood pressure, high cholesterol, diabetes, knowing if they have any genetic conditions are very important, because that means that you may be a little bit more susceptible than someone else to developing these problems, even if you take pretty darn good care of yourself. You've got any genetics fighting against you, right? You may have to work a little bit harder, right? To make sure that those things don't creep up. And sometimes people, because of that higher susceptibility, they are more commonly developing these problems a lot younger. And the ability to kind of do what you want, eat what you want, sit on the couch doesn't work for you, because your genetics, whether you realize it or not, says, nah, sorry, you can't get away with that. So the earlier the better. I'm going to preach this because I'm sure I have a large population of men watching today. Yeah. Is that unfortunately, men, particularly in the African American community, do not go to the doctor on a consistent basis. We could go into a whole conversation about where that comes from, the source, a lot of fear as to why our community is scared of us and untrustworthy of us. But I want to encourage everyone to find a way to have a little bit more trust in us, because unfortunately, we're seeing our community more and more suffer more and more from conditions like this, simply for one reason: they just don't go to the doctor and don't trust it. And it can be caught that quickly. Go to the doctor and guess what? You got to have high blood pressure. I might have just saved you from the stroke you were going to have in 5 years. Right? So go to your doctor every year, regular basis. And don't go when you're sick. Right. Go when you're fine. Go now. Because like I said, you can develop health problems that you don't even know you have until they get bad. By screening now, you already are ahead of the game. So if something's starting to creep up, you've already caught it before it gets to a point where it's too late.
Yeah, people don't realize you need to know what your normal is. If you don't have a baseline, then when stuff isn't normal, like it's a little harder to tell.
Absolutely.
So looks like we have some questions in the chat. I tried to answer some of them as we kind of went along, but we got a few more.
Okay.
What are the percentages of stroke within certain age ranges? So obviously older people are probably more susceptible, but are there certain age ranges that pop out as far as having problems, or is it just across the board? Or?
It's across the board. I mean, I don't know the exact numbers. I'm sure that, because people probably break them down by community, state, country, region. It is, most of my patients are probably over the age of 60. I would say most. But I do have a small population that's in the 30 to 60 range as well. But, like I mentioned, I always say, don't use that as an excuse to say, whatever, I'm 35. I can just go live my life. I don't need to see a doctor yet. I feel fine, right? You may feel fine. You may not be fine. So that's why I say start your health maintenance journey early.
And then we have another question about stress. So like, can stress in and of itself make you more susceptible or even cause a stroke?
That is such a good question. I get this all the time. Doc, it was stress, right? Stress did this, right? So it's a yes and a no. And I'll say it in this way. I think from a negative side, sometimes people use stress as an excuse to ignore the fact that the reason this happened is from not taking care of yourself outside of stress. Not realizing, no, you have a diabetes problem. You have a diet problem. You have an obesity problem. You have to quit smoking. Well, no, it's just stress. No, you've got a list of other things as to probably why this happened. And so I remind people, I don't know anybody who lives this life that we live stress-free. We all have it. It's not easy, okay? And we all manage it in different ways. Some manage it better than others. The way that I've seen stress really directly impact folks in terms of stroke is High stress environments can raise your blood pressure. High stress environments can prevent you from taking the time to do self-care, which includes taking care of yourself, right? I'm stressed out. I'm just going to go get a Big Mac from McDonald's instead of go home and cook a nice healthy meal, right? And so in itself, stress precipitates behavior that therefore precipitates those risk factors that can cause a stroke. So I always, me and my line of work can be extremely stress-free. And I had one of those weeks this week. I'm glad to not be working today. And I have learned, even in my mid-30s, I have to practice self-care to reduce my stress levels, to therefore not make those stress levels precipitate unhealthy habits or increase my blood pressure in a way that's too much for my brain to handle. Now, I don't have hypertension right now. I see my doctor every year. My blood pressure is fine. But if you have high blood pressure and you're taking your medicine regularly and you think your numbers are okay, and now you pop yourself into a higher stress environment that you're having trouble controlling, now your pressure's higher than it should be. Like I said, instead of cooking those meals for dinner that you normally do, every night you're going to Burger King and Checkers and McDonald's because it's easier because you're stressed, right? To go pick up something fast and something junk, because junk food always makes us feel better, right? Always makes us feel better, okay?
It's good.
Right? But what happens is that stress has now precipitated unhealthy habits. And as a result, now all those problems, now your sugar's up, right? Now your cholesterol's up, now your blood pressure's up, and here we are having a stroke. So that's the way that stress is sort of related. It usually isn't like, I just had a bad day at work. It is something that's sort of been precipitating and boiling where your body has not been happy or healthy for some time. And it got to a point where it reached a breaking point. Your brain and your heart holds on as long as it can. It really does. The body really is phenomenal in the way that it tries to compensate and make up for it not feeling very well. But it always gets to a breaking point where it says, I can't take this anymore. And that's what ends up happening. And you can therefore have a stroke.
So for those annual physicals, so you can try to, make sure you're doing okay. Is there any particular screening specifically for stroke, any blood tests, or are you just looking for those risk factors that could lead to one?
So mainly you're just looking for those risk factors. There's no, blood test I can give you that's going to say you're going to have a higher risk of stroke than someone else. There's no marker in your blood that says you're going to have a stroke in 5 years if you don't get your life together, right? So part of primary care and regularly seeing your doctor is exactly what you said. It's screening you for those risk factors for increased risk. And you mentioned something about, colon cancer in our community is ramping up younger. Cancer is a risk factor for stroke because by definition, when you've got cancer in your body, your blood is way thicker than a regular person. And as a result, it increases your risk of clots and clots that can therefore also affect the arteries in your brain. And so the screening for everything, your pressure, your cholesterol, your diabetes, your liver, your kidneys, cancer, all those things are involved in making sure that your risk of stroke is reduced by making sure you identify those problems if you have them, get treatment now, and change your lifestyle now, so it doesn't end up impacting you in a way in the form of a stroke.
And then we have one more question. Is there a particular blood pressure level that puts you at a higher risk, or, is there a certain elevation or anything like that?
Yeah, so basically anything that is elevated. So normal blood pressure is technically 120/80, and people have a variety of variations within that range. You really become what we consider true hypertension when that top number, that 120, starts to get to 140. And technically that's high. That's too high. Now, in my line of work, most of my patients do not have a stroke at that blood pressure level. But what I tell people is, let's just say that you were living normal for years, and then you've made a drastic change in your lifestyle. Maybe you're piling salt in all your food, or you've gained a bunch of weight, or you're not exercising anymore, or all you're doing is eating that fast food. That change in blood pressure may be too much for your brain. Your brain may say 140 is too much for me. I can't take it. I'm not going to wait till it's 160. I'm not going to wait till it's 180. I'm not going to wait till it's 200. So I always tell people, if you're at home, you're taking your blood pressure pills and you're like, oh, my top number is like 155. I'm not going to have a stroke. You can very much have one, because everybody's standard of when your brain gets to its breaking point is variable to every person. So I have people have had a stroke and their pressure's in the 150s. I've had people that have a stroke and their pressure had to wait to get to 200, right? You don't know what your brain's threshold is. So no amount of high blood pressure should be okay or acceptable, because that's just your brain. We're not even talking about the rest of your body who doesn't like high blood pressure either, especially that big thing in your heart, because your heart and your brain are completely connected. The tubes that connect your heart are directly connected to your brain. So if your heart's not happy, your brain's at risk of not being happy. And so most things that people tell you about heart health are the exact things to do for stroke health, because they're one and the same. The tubes are directly connected to one another. They are not separate.
Then we had another question just pop up. And you kind of touched on this already, but a person that is doing all the right things, they're exercising, eating right, et cetera, can they still have a stroke?
So the answer is yes. And it's yes in a means of the reason why you may have a stroke is not because of the things that you're doing wrong. Most people who take good care of themselves and don't have those risk factors don't have a stroke, okay? But like I said, I do have young patients that are in their 30s or 40s who are completely healthy, exercise, in good shape, eat right, don't have any of those issues, don't smoke, see their doctor every year, end up having a stroke. Why? It ends up being something that's not controllable. It's something genetic, some blood condition they didn't know they had, something structurally wrong with their heart they never would have known they had until they had a stroke. And so sometimes there's things that are just out of your genetic, your control, right? Unfortunately, you're not going to know, right? So unless, let's just say you have a strong family history of a particular condition and your doctor says, oh, wait, your father, your grandfather, you got a list of people that have this problem that can increase your risk for stroke, you're not going to get screened, right, for any of these things. So you may not know you have it, right? And so your best shot is just do the things that you can do to prevent you having a stroke that you are in control of. If you have a stroke out of something that's out of your control, it's out of your control, right? And I think that's just the word of life, right? You got to keep it moving. You got to live your life. There's some things that we are out of our control, and you can't stress over things that you can't even control. So if you take care of you, you're already going to drop your stroke risk precipitously. If there's something out of your control that caused you to have a stroke, in the end, the good news is this. At my line, I've learned that when it comes to recovery, people that tend to have a good baseline, meaning they really take good care of themselves and this oops happened, right? I have a hole in my heart, didn't know, right? They tend to do better when it comes to recovery. Their bodies are in better shape. They're better equipped to improve and get better. When you've had a stroke and your diabetes is out of control and your pressure's out of control and you're overweight, your body doesn't have the sustenance that may have if it was healthier to get through this utter stress of injury that's happened to you. Stroke takes a big hit to your body, right? So if you are in shape and take good care of yourself and something happens to you that's completely not your fault, you're in a better place to heal simply because you're healthier. So I always say, look, don't worry about stuff you can't control. Focus on the stuff you can. You can control what you put in your mouth. You can control how much you move your body, right? You can control how much you take care of your regular health by routinely seeing your doctor to screen you for things that you may not even realize that you have. And that gives you your best shot for living your entire life stroke-free.
So something I appreciate is that you actually, you clearly have a passion for this. This isn't simply a job for you. I can hear it in the way you talk. In the interest of time, as we wrap up, do you have anything, like any parting words, like if somebody doesn't get anything else out of this talk today, have anything for them?
I think the biggest lesson I tell people is just don't wait. Don't wait. Don't wait a second. Don't wait a millisecond. Something's wrong. You call 911. We have done a lot of work in this medical community to get to this point. It's a really big deal for that to go from 4th to 5th. Huge. And it tells you that we can help you. Okay. 25, 30 years ago, people would say, oh, if I'm having a stroke, doesn't matter anyway, they can't fix it. Guess what? That is over. So because we can help most people, you've got to get to the emergency room. Call 911 immediately. If you muted yourself to this entire talk, just tell yourself to go to the hospital immediately. Do not pass go. Do not collect $200. Don't phone a friend. Don't call your doctor. That's the biggest thing I have to tell people. Well, Dr. Mahdi, I'll just call. No, you won't. I can't help you over the phone. I can't send you medicine through your phone. Everything that you need to take care of yourself is in an emergency room. So you have to get to one as soon as possible. And even if you don't know what's going on, I don't know if it's a stroke, I don't know if they can help me, I don't know what's going to happen to me, you let us take care of that part, and you just do your part, which is get your butt to the hospital.
There it is. Be fast. So
Be fast.
Once again, thank you, Dr. Mahdi, so much for your time, your passion, your dedication to this work, especially serving the community here in Maryland.
Well, you're very welcome. Thank you again for having me. It's really been a pleasure joining all of you today.
All right. So you take care. And for those who might have joined late, it'll still be available on demand for later viewing. So thank you, everyone.
Have a good day.